Hello. Welcome to Health and Life, your source for beneficial knowledge about health and life. If this is your first time visiting our channel, don't forget to subscribe and turn on notifications so you don't miss out on any helpful videos. Today, we're going to talk about a problem that many people face: sciatica and carpal tunnel syndrome. You might not know, but a deficiency in vitamins B1, B6, and B12 can be a major cause of pain, numbness, and muscle weakness. So how do you recognize if you're deficient in these vitamins? And how do you supplement correctly? Let's find out right now. The nervous system plays a central role in controlling movement and sensation in the body. When a nerve is compressed or damaged, it can lead to chronic pain, numbness, or loss of sensation in certain areas. Two common conditions related to this problem are sciatica and carpal tunnel syndrome. Sciatica usually starts in the lower back, radiates down the buttocks, and extends along the back of the leg. The pain can become severe when sitting for long periods, driving, or changing position suddenly. Carpal tunnel syndrome causes numbness, tingling, and weakness in the hand due to compression of the median nerve in the wrist. Many patients facing these two conditions often turn to surgery as a last resort. However, in many cases, proper nutritional supplementation, especially B vitamins, can significantly improve symptoms without the need for surgical intervention. Studies show that 3 important B vitamins, B1, B6, and B12 play an essential role in maintaining and protecting the nervous system, helping to prevent and support the treatment of peripheral nerve diseases, including sciatica and carpal tunnel syndrome. So how do these micronutrients affect the nervous system? How do you recognize if your body is deficient in them? Let's delve deeper into each vitamin to better understand their role in nerve health. The nervous system is a complex network where electrical and chemical signals are constantly transmitted to maintain vital bodily functions. Among the micronutrients that support nerve activity, vitamin B6, pyridoxine, plays an indispensable role, especially for sensory nerves, those responsible for processing pain, numbness, and burning sensations. Why is vitamin B6 important for the nervous system? One of the most prominent roles of B6 is to help synthesize myelin, the protective sheath around nerves. Similar to the insulation of an electrical wire, when this protective layer is damaged or weakened, nerve signals are disrupted, causing numbness, tingling, or even intense, sharp pain. Not only that, B6 also participates in the production of serotonin and dopamine, two important neurotransmitters that help maintain a stable mental state and prevent nervous tension. If B6 is deficient, the nervous system will function less effectively, leading to sensory disturbances, fatigue, depression, and even visual disturbances, myopia, and seizures. One thing that few people notice is that B6 also affects the speed of nerve conduction. Studies show that when the body is adequately supplied with vitamin B6, nerve signals are transmitted faster, helping to improve reflexes and reduce the risk of nerve damage. This is especially important for people with sciatica and carpal tunnel syndrome. Not all forms of B6 are beneficial. One point to note is that simply supplementing with a lot of B6 isn't necessarily good. Vitamin B6 exists in two forms. Pyridoxine, in active form, must be metabolized by the liver into pyridoxal 5-phosphate, P5P, the active form that the body can use. Pyridoxal 5-phosphate, P5P, active form, can directly support the nerves without needing to be metabolized. A common mistake is that many people take too much pyridoxine, leading to a competition for absorption with P5P. In this case, instead of helping, pyridoxine hinders the body from using B6, causing the very symptoms of deficiency such as numbness, tingling, and pain. This is why many people take B6 supplements and still have signs of nervous disorders without understanding the reason. Who is at risk of B6 deficiency? Although the daily B6 requirement is not high, many factors can reduce absorption or increase the body's need for this vitamin. Use of birth control pills, diabetes medication, or alcohol. These substances reduce absorption or increase the excretion of B6 in urine. Inflammatory bowel diseases such as Crohn's, celiac, reduce the ability to absorb B6 from food. Diet low in meat, especially vegetarian. Vitamin B6 is abundant in meat, fish, and eggs. So vegetarians are at higher risk of deficiency. Poor absorption due to age or genetic factors. As we age, the ability to metabolize B6 declines, making the body more prone to deficiency. Drinking too much coffee, over 4 cups per day. Caffeine can increase the excretion of B6 through the kidneys, causing an imbalance of vitamins in the body. If you are experiencing symptoms such as numbness in the limbs, nerve pain, or mild seizures, consider supplementing with vitamin B6. However, to avoid the risk of imbalance, it is best to choose the P5P form instead of regular pyridoxine. This ensures that the body can use B6 effectively without encountering the absorption competition mentioned above. In addition, if you have a lifestyle that can easily lead to B6 deficiency, drinking alcohol, using birth control, vegetarianism, adjust your diet and consider supplementing with foods rich in B6 such as salmon, chicken, bananas, or sunflower seeds. If vitamin B6 plays a role in supporting sensory nerves, vitamin B12, cobalamin, is an indispensable foundation in the regeneration and protection of the nervous system. When it comes to nerve health, we cannot ignore myelin, the protective sheath surrounding the nerves, which helps signals travel quickly and accurately. And a worrying fact is that if vitamin B12 is deficient for a long time, this sheath can be severely damaged, causing irreversible neurological disorders. Vitamin B12 and its important role in the nervous system. B12 not only helps maintain myelin, but also stimulates the development and regeneration of nerves, especially in diseases related to nerve damage such as sciatica and carpal tunnel syndrome. It is worth noting that the symptoms of B12 deficiency can be very vague and progress slowly, causing many people not to realize it until the nervous system has been severely damaged. Common signs include numbness, tingling in the hands and feet, similar to peripheral neuropathy, muscle weakness, decreased reflexes, memory loss, difficulty concentrating, even depression, loss of balance, dizziness due to the nervous system not coordinating well. The dangerous thing is that nerve damage due to B12 deficiency may not recover if not detected early. Therefore, if you are having any of the above symptoms, it is very important to check and supplement with B12 in a timely manner. Who is at high risk of B12 deficiency? Unlike B6, vitamin B12 is only found in foods of animal origin such as meat, fish, eggs, especially organs such as liver. Therefore, the groups of people at high risk of B12 deficiency include vegetarians or vegans. If you do not consume any animal foods, you are almost certain to be deficient in B12, as plants do not contain this vitamin. People with low stomach acid. B12 needs a strong acidic environment in the stomach to be absorbed. People with gastroesophageal reflux disease, GERD, gastritis, or who use acid-suppressing drugs for a long time often have difficulty absorbing B12. People with genetic factors that cause poor B12 absorption. Some people have the MTHFR gene mutation, which makes it difficult for them to metabolize and absorb B12 effectively. This is why some people, even if they eat a lot of B12-containing foods, still have signs of deficiency. People who drink too much folic acid, B9. This is something few people know. High doses of folic acid can mask B12 deficiency, preventing patients from detecting the problem until the nerves have been damaged. So, if you supplement with folic acid, make sure to balance it with an appropriate amount of B12. Cyanobalamin or methylcobalamin, which is better? When supplementing with vitamin B12, you will see two common forms. Cyanobalamin. This is a synthetic form, cheaper but harder to absorb and needs to go through many metabolic steps in the body. Methylcobalamin. This is a natural form, easier to absorb and has better ability to support the nervous system because it has the methyl group needed for myelin regeneration. Choosing the right form of B12 can help you absorb better and avoid the risk of potential deficiency. If you are in the group at risk of B12 deficiency, I recommend prioritizing the methylcobalamin form instead of cyanobalamin for optimal effectiveness. If you have a diet low in animal foods, check your B12 levels regularly and supplement when necessary. If you are taking medication to treat gastroesophageal reflux or gastritis, consider supplementing with B12 in the form of injections or under the tongue to help absorb better. Prioritize methylcobalamin instead of cyanobalamin to ensure that the body receives the most usable form of B12. If you are taking folic acid supplements, make sure you are also providing enough B12 to avoid masking the deficiency. If B6 supports nerve sensation and B12 helps regenerate myelin, then vitamin B1, thiamine, acts as a fuel provider for the nervous system. Without enough B1, the nerves cannot function optimally, easily leading to fatigue, memory loss, and even serious nerve damage. Our nervous system is very sensitive to energy deficiency, and B1 is the factor that helps convert carbohydrates into ATP, cellular energy. Without enough ATP, nerve cells are easily weakened and damaged, especially in diseases related to diabetes and peripheral nerve damage. The important role of B1 with the nervous system. B1 is not just a simple vitamin, but also an important factor in maintaining blood circulation and oxygen to the nerves. When the nervous system does not receive enough energy and oxygen, symptoms such as numbness, pain, cramps, or muscle weakness will appear. This is especially common in people with diabetes, as glucose metabolism disorders can increase the need for B1. In addition, B1 is also a powerful antioxidant, helping to protect the nerves from damage caused by oxidative stress, one of the main causes of nerve inflammation and degeneration. This is why B1 deficiency can exacerbate diseases such as sciatica, diabetic neuropathy, and even memory loss. Risk of B1 deficiency. Who is most affected? Although B1 is present in many foods such as whole grains, meat, and beans, there is a worrying fact. Many people today are still deficient in B1 without knowing it. High-risk groups include people who consume a lot of sugar and carbohydrates, a diet high in white bread, white rice, soft drinks, and junk food can quickly deplete B1. As B1 participates in carbohydrate metabolism, people who drink a lot of coffee and tea, caffeine can reduce B1 absorption, making people who drink more than 4 cups of coffee per day prone to deficiency. People with diabetes or prediabetes. People with problems with sugar metabolism often have lower B1 levels than normal, increasing the risk of nerve damage. This is also why B1 supplementation is considered an important part of supporting the treatment of diabetic neuropathy. B1 deficiency can cause many symptoms from mild to severe, including checkmark fatigue, sluggishness, memory loss, checkmark numbness, tingling in the hands and feet, muscle weakness, checkmark prolonged nerve pain, especially in people with diabetes, checkmark heart rhythm disorders, difficulty breathing, due to the role of B1 in the circulatory system. Thiamine or benfotiamine, which is better? Not all forms of vitamin B1 are the same. The regular form is thiamine, but it is water-soluble, making it easily excreted from the body and difficult to absorb. That's why many experts recommend using benfotiamine, a fat-soluble form of B1, which helps absorb better and penetrates the nervous system more effectively. If you need to supplement with B1 to protect the nerves or support the treatment of nerve pain due to diabetes, benfotiamine is the optimal choice. It not only improves absorption but also helps reduce nerve inflammation, enhance circulation, and protect nerve cells from damage. Checkmark if you regularly eat a lot of carbohydrates and sugar. Consider supplementing with B1 to avoid deficiency. Checkmark if you drink a lot of coffee or tea. Make sure your B1 levels do not drop too much. Checkmark if you have diabetes or have symptoms of nerve numbness. Prioritize benfotiamine instead of regular thiamine. Checkmark don't wait until symptoms appear to supplement. Actively protect your nervous system from now on. When the body sends signals such as numbness, pain, muscle weakness, or even loss of movement control, it may be a warning that your nervous system is having problems. Instead of just focusing on temporary pain relief measures or immediately thinking about surgery, check if the cause is due to vitamin B deficiency. Not everyone realizes that B1, B6, and B12 are important pillars that help the nervous system function healthily. If not supplemented enough, the nerves will be damaged over time, leading to many more serious consequences. So how do you know which B vitamin you should supplement with? Here is a simple but extremely effective guide. Magnifying glass: how to choose the right B vitamin for your symptoms. Checkmark if you have problems with nerve sensation, numbness, Pain, burning, tingling. Right arrow vitamin B6, pyridoxal 5-phosphate, P5P, is the most appropriate choice. B6 plays an important role in creating neurotransmitters and protecting sensory nerves from inflammation and damage. Checkmark if you feel muscle weakness, spasms, loss of movement control. Right arrow vitamin B12, methylcobalamin, is the best choice. B12 not only helps regenerate but also restores and protects the myelin sheath, the nerve protective layer, helping to improve movement and reflexes. Checkmark if you have diabetes, eat a lot of sugar, or have problems with carbohydrate metabolism. Right arrow vitamin B1, benfotiamine, is the optimal solution. Benfotiamine helps protect the nerves from damage caused by high blood sugar and improves blood circulation to the nervous system. In other words, each type of B vitamin has its own mission, and choosing the right type according to symptoms will help you achieve the best results. Stop sign: don't let your nervous system deteriorate before taking action. Many people only care about the health of the nervous system when the pain has become severe. But it is important that prevention is always better than cure. If you are in a group at risk of vitamin B deficiency, such as people with diabetes, vegetarians, consuming a lot of caffeine, drinking alcohol, or taking drugs that reduce B absorption, actively supplement before symptoms appear. In addition to nutritional supplementation, don't forget to combine it with other supportive methods, such as checkmark exercising to improve the lumbar spine curve to help reduce pressure on the sciatic nerve. Checkmark maintaining a balanced diet, avoiding foods that deplete vitamin B such as refined sugar and alcohol. Checkmark getting enough sleep and reducing stress, as prolonged stress can impair nervous system function. Light bulb: don't let pain make you lose your quality of life. Light bulb supplementing with vitamin B properly can help improve symptoms without the need for surgery. Light bulb: the combination of nutrition, healthy lifestyle, and exercise will help your nervous system stay healthy. Many people think that sciatica or carpal tunnel syndrome is caused by injury or degeneration. But in fact, deficiency of vitamins B1, B6, and B12 can also be the cause of these problems. If you have tried many methods but the symptoms still do not improve, review your diet. Magnifying glass: B6, guardian of sensory nerves. Vitamin B6 plays an important role in maintaining the function of sensory nerves. If you often experience numbness, tingling, burning sensations in your hands or feet, your body is likely deficient in B6. However, simply taking B6 is not good. The regular pyridoxine form may not bring optimal results. And even overdosing can inhibit the active form of B6. Therefore, pyridoxal 5-phosphate, P5P, is the right choice. Right finger real-life example. Some office workers who regularly type on the keyboard have carpal tunnel syndrome and choose the solution of splinting or surgery. But in fact, if B6 is deficient, supplementing with P5P combined with adjusting working posture can help improve this condition without the need for surgery. Brain: B12, golden nutrient for nerve regeneration. B12 is considered a powerful assistant to the nervous system. If you feel muscle weakness, tremors, loss of movement control, or have a needle prick sensation spreading along your limbs, it may be a sign that your body is severely deficient in B12. Methylcobalamin is more easily absorbed and has a higher effectiveness than cyanobalamin, the synthetic form commonly found in many cheap supplements. Right finger real-life example. A long-term vegetarian for many years but often feels tired, dizzy, and has numbness in the limbs. After checking, found that he was severely deficient in B12. This is because B12 is mainly found in foods from animals. And if not supplemented properly, the body will be affected for a long time. High voltage B1 energy source for nerve activity. Vitamin B1 not only helps convert carbohydrates into energy but also plays an important role in blood circulation and providing oxygen to the nerves. If you eat a lot of sugar, drink a lot of coffee, or have diabetes, you are at high risk of B1 deficiency. Benfotiamine, fat-soluble, absorbs better and helps protect the nerves from damage. Right finger real-life example. A person with a diet high in carbohydrates, often drinking coffee to stay awake but feels tired, numb limbs, Has signs of diabetic neuropathy. This may be a consequence of consuming B1 too quickly without replenishing it in time. Small diamond. Review your diet. If you are a vegetarian, drink alcohol, use a lot of coffee or drugs that reduce vitamin absorption. Consider supplementing with the appropriate B vitamin. Small diamond. If you experience neurological symptoms, consider supplementing with P5P, B6, Methylcobalamin, B12, and Benfotiamine, B1, instead of waiting until nerve damage becomes severe. Small diamond. Combine with exercise. Adjust sitting posture. Reduce stress so that the nervous system has the best conditions to recover. Thus, we have explored the important role of vitamins B1, B6, and B12 for the nervous system, as well as how to supplement appropriately to improve the condition of sciatica and carpal tunnel syndrome. If you find this video helpful, please like, share it with people who need to know, and don't forget to subscribe to Health and Life channel to update more useful health knowledge. In addition, if you have any questions about diseases, foods that are good for health, beneficial exercises, or nutrients needed for the body, leave a comment below. We will answer you. See you in the next videos.